Chlamydial conjunctivitis, pathophysiology. So what is chlamydial conjunctivitis? It is also known as inclusion conjunctivitis. It's a bacterial eye infection caused by Chlamydia trachomatis. It is a sexually transmitted disease that can affect the eyes, often after hand-to-eye contact with infected genital secretions. Symptoms can include redness, swelling, itching, and discharge. So, chlamydial conjunctivitis is commonly caused by chlamydial trachomatis. So, is influenced by both non-modifiable and modifiable risk factors. So, the non-modifiable risk factors includes the age, with infants, adolescents, and young adults being more susceptible. Being born to mothers with untreated chlamydia, and a genetic predispositions to exaggerated immune responses. So, on the other hand, modifiable risk factors include poor genital hygiene, unprotected sexual activity, sharing contaminated towels or cosmetics, and lack of regular STI screening and treatment. So, the infections begins with Chlamydia trachomatis, is transmitted to the conjunctiva through genital secretions, contaminated hands, or during birth. So, the bacteria reach the conjunctival epithelium and enter as elementary bodies. So, yung elementary bodies daw is yung mga responsible to start and spread infections to the eye, which are the infectious forms. So, inside the host epithelial cells, so the EBS, convert into reticulate bodies, so which replicate and eventually magre-revert siya to elementary bodies. So, these newly formed elementary bodies are released upon host cell lysis and spread to adjacent cells, perpetuating reinfection. The immune system is activated in the response to the infection. So, pro-inflammatory cytokines such as the interleukins 1 and 6 and the TNFA or alpha are released, recruiting neutrophils, macrophages, and lymphocytes to the site. So, this leads to vasodilation, wherein increased vascular permeability, wherein stimulation of sensory nerve endings, and an inflammatory response as fluid leaks out of the capillaries into the conjunctiva. So, symptoms like redness, or what we call the conjunctival hyperemia, swelling or edechemosis, and then the itching is developed. Upon redness or conjunctival hyperemia, there is a medication which is erythromycin ophthalmic ointment to treat the redness. So, based on the symptoms, we've come up with the nursing diagnosis of impaired comfort related to conjunctival inflammation secondary to Chlamydia trachomatis infection, and the nursing management are educate the patient to avoid rubbing their eyes to prevent worsening inflammation, apply cool compresses to relieve itching and irritation, administer prescribed medications such as the corticosteroid, eye drops like dexamethasone as ordered, and also maintain eye hygiene by gently cleaning any discharge with sterile saline or wipes, and educate the patient about avoiding known irritants or allergens and practicing hand hygiene to reduce infection risk. So, the antigenic stimulation caused by chlamydia activates conjunctival-associated lymphoid tissue, or what we call the CULT. So, this is the part of the eye's immune system. Specifically, located siya sa conjunctiva. So, ito yung thin membrane na nagko-cover sa white part ng eye and inner eyelids natin. So, recruiting lymphocytes and especially B lymphocytes. So, B cells proliferate and form lymphoid follicles in the subepithelial layer. So, especially in the lower fornix. So, this contributes to visible follicular reactions and ongoing inflammation. So the medication includes oral azithromycin and oral doxycycline for and also for the diagnostic test, we have direct fluorescent antibodies test and polymerase chain reaction. So based on the symptoms, the nursing diagnosis is risk for corneal injury related to conjunctival inflammation and potential for corneal involvement, and nursing management is or are explain the possibility of cornea problems such as the pain, blurred vision, light sensitivity from the infection. Next is educate the patient to avoid rubbing their eyes to prevent worsening inflammation. Next is stress the importance of taking all prescribed antibiotics to fight the infection causing inflammation. Next is monitor patient changes and adhere to antibiotics and other medications to be used. Meanwhile, epithelial damage, stimulation of goblet cells, and accumulation of dead cells and pus results in mucopurulent discharge, dried exudates, and eyelid crusting. So, for the laboratory test of mucopurulent discharge from the conjunctiva is we have nucleic acid amplification test, or what we call the NAAT. It is the gold standard test for diagnosing chlamydial infections, including chlamydial conjunctivitis. So, it can detect infections earlier and more accurately than culture or antigen-based test. So, based on the symptoms, we've come up with the nursing diagnosis of risk for infection, transmissions related to accumulations of mucopurulent discharge, and eyelid crusting, and also the nursing management or gently cleanse the eyelids with warm sterile saline or prescribed solutions to soften the and also remove the crust and dry discharge. Teach the patient proper hand hygiene before and after touching the eyes. Apply prescribed antibiotic eye drops or ointments as ordered to manage bacterial infection. And also, instruct the patient to share towels, cosmetics, or personal items to prevent transmissions, and monitor the affected area for changes or worsening of symptoms. Infiltration of immune cells and tissue edema that leads to follicular hypertrophy and papillary reaction on the inner eyelid. So, friction from